So hi friends, welcome back to my channel Sims Nurses Corner. Today we are going to discuss another procedure, cardiac catheterization. In this nurses play a vital role for the patient preparation and post care also. So let's discuss the cardiac catheterization. Before going to the topic, I will give an introduction. See, cardiac catheterization is an invasive procedure. Okay, in this a catheter is introduced into the patient body, and through this we are visualizing the heart. Okay, heart or blood vessels, heart blood vessels, coronary arteries we are visualizing through this. Okay, and we can use as diagnostic and therapeutic for methods. Okay, so we can see the introduction. See, cardiac catheterization is procedure performed for both the diagnostic and interventional purposes. Okay, the role of nurse is important while pre-catheterization, intra-catheterization and post-catheterization. Okay, role is important. So let's move to the definition. It is one of the invasive procedure. Okay, invasive procedure means it causes a small wound in the patient body and introducing the catheter inside the patient body. So it is an invasive procedure used to visualize the heart chambers. Okay, heart chambers, then valves and great vessels such as great vessel is aorta. Okay, in order to diagnose and treat the abnormalities of coronary arteries also. Okay, it is one of the invasive procedure used to visualize the heart chambers, valves and great vessels in order to diagnose and treat the abnormalities of coronary arteries. Okay. Cardiac catheterization. What are the purposes? First one, to analyze these things we have to analyze. We can analyze through the cardiac catheterization. First one is to evaluate the cardiac vessels. So coronary artery vessel we can analyze. Then chamber pressure can assess, and oxygen saturation can analyze, and to analyze ventricular function, to analyze the valvular insufficiency, to analyze whether any stenosis, to analyze any septal defect, to analyze the congenital abnormalities, or to analyze the myocardial infarction. And the next one is as a post evaluation method of for any treatment. Okay, when giving post evaluation, that is better word. Okay, these are the purposes. Next one, what are the indications of cardiac catheterization? Indications. See, indications are classified mainly into three categories. First one is diagnostic, second one is therapeutic, and the third one is prognostic. Okay, first one is diagnostic, to collect the patient evaluation data. See, for MI, we are doing the coronary angiogram. Okay, CAG, coronary angiogram. This is a diagnostic indication. Okay, if there is a blockage in the artery, we are doing the angioplasty. Okay, that is a therapeutic indication. Okay, that is therapeutic. Then prognostic means once patient had done any procedures, any cardiac catheterization procedures, and we have to analyze again. That is any prognosis of the patient we can assess through the cardiac catheterization process. Okay. These are the indication, diagnostic and therapeutic and prognostic. Then indication of cardiac catheterization. First indication, diagnostic. What are the diagnostic cardiac indications? Okay. First one is to assess the pulmonary hypertension, to assess the pulmonary tree evaluation. Then to evaluate the cardiac shunts, intracardiac shunts evaluation. Next one, interventional cardiac catheterization indications. What are the interventional cardiac catheterization or therapeutic cardiac catheterization indications? First one, dilation of valves and valvuloplasties can be assessed. Then dilation of vessels or angioplasties. Okay, these are indication. Then closure of patent ductus arteriosus, PDA. Okay, closure of patent ductus arteriosus. Then closure of ASD, atrial septal defect. These are doing for children's. Okay, babies. Then closure of ventricular septal defects, VSD. Then closure of abnormal collaterals and abnormal vascular shunts. Okay, abnormal collaterals and abnormal vascular shunts. Then pulmonary valve replacement. Then hybrid procedures. Then endomyocardial biopsy. Okay, endomyocardial biopsy. These are the indications of cardiac catheterization. Next one, contraindications of cardiac catheterization. What are the contraindications? First one is uncontrolled hypertension. Okay, chance of rupture is there. So Uncontrolled hypertension is a contraindication for cardiac catheterization. Then severe anemia, there is a chance of bleeding, so severe anemia is contraindicated. Then ventricular fibrillation. Ventricular fibrillation means heart is moving, shivering like that. So pooling of blood will be occur and it will cause complications. So ventricular fibrillation is contraindicated. During ventricular fibrillation, contraindicated cardiac catheterization, then acute stroke, then GA bleeds, then allergy to contrast. Okay, allergy contrast we are using. So allergy to contrast. Then renal failure, then uncompensated congestive failure. Okay, renal failure means if creatinine is increased, the once the contrast is eliminated through kidney only. Okay. So urine only it is eliminating. If renal failure is there, the contrast will be remaining in the patient body. So renal failure, the cardiac catheterization is contraindicated. Then uncompensated congestive failure, then active infection or febrile illness, the electrolyte abnormalities, then severe coagulopathies. Okay, these are the contraindications: uncontrolled hypertension, severe anemia, ventricular fibrillation, acute stroke, then GA bleed, allergy to contrast, renal failure, uncompensated congestive failure, active infection or febrile illness, electrolyte abnormalities, and severe coagulopathy. Then what are the patient preparations? Patient preparation. First of all, doctor's order. Doctor should be the right day before the procedure, and the informed consent should be taken. Informed consent. Then lab test, pre-lab test should be done, such as CBC, ESR, RFT, renal function test, PT, INR, echo, X-ray, serology. These are the lab tests we have to do priorly. Then check allergy for iodine or seafoods. Okay, seafoods contain iodine, so check for allergy for iodine or seafoods. Then screen preparation how to do, IV cannulation how to do, placement of ECG electrodes how to do. Then check pedal pulse and mark it. Dorsalis pedis and posterior tibia. Okay, post procedure we have to assess the distal pulse. So check the pedal pulse and mark it. Then monitor hemodynamic status of the patient. Then keep NPO for 6 to 8 hours. Okay, keep NPO for 6 to 8 hours. And patient preparation continues. If creatinine is above 1.5, okay, if creatinine is above 1.5, we have to start IV fluids. Okay, 6 hours prior to angiogram. As per physician order, we have to start the IV fluids. Okay, then 12 lead ECG have to take 12 lead ECG. Then due medicines. As per doctor's order, we have to give the due medicines such as aspirin, clopidogrel, and pantoprazole, diazepam, etc. Okay, then empty the bladder before shifting the patient to cath lab. Okay, empty the bladder. Then explain the procedure to the patient. Okay, and mainly there is a hot flush experience during injection of dye. We have to explain to the patient. Okay, and some patients may chance of experiencing nausea and vomiting. These also we have to educate the patient, and assist the patient to go wear OT dress or cath lab dress. Where whatever according to the hospital policy, we have to wear the cath lab or OT dress. And then check for any implants and angios, and if it is a see if it is a temporary or temporary, we have to remove, and permanent we have to inform to the cath lab about the implants. Okay, then hand over the valuables to appropriate person and check and document height and weight in order to assess or calculate the amount of contrast needed for this patient. Okay, these are the patient preparation. Then what are the contrast agents we are using? First one is sodium dihydroxide. This is we are using commonly. Okay, sodium dihydroxide. Then lohexol, then lovosol, and loxaglate. Okay, these are the contrast agents. Next one, types of cardiac catheterization. What are the types of cardiac catheterization? There are two types: right heart catheterization and left heart catheterization. Okay, two types of cardiac catheterization. So next we can see what are the sites used in cardiac catheterization. Okay, sites. For right side cardiac catheterization, we are using femoral vein and antecubital vein, this area. Okay, femoral vein and antecubital area we are using for right side heart cardiac catheterization, and for left side heart cardiac catheterization, brachial artery, radial artery, and femoral artery. Okay, brachial, radial, and femoral arteries we are using. Next we can see the procedure. What are the procedures? As per the site or type of catheterization, a fluoroscopic catheter is inserted into the appropriate vessel. Okay, whether it is radial artery or femoral artery, we are introducing a fluoroscopic catheter. And when once catheter is introduced, we have to assess the advancement of catheter. That is where the catheter is reached through X-ray fluoroscopic image. Okay, this person is watching through this monitor. Okay, X-ray fluoroscopic machine. We are checking the advancement of catheter, and these images are recorded for evidence. Okay, images are recorded for evidence. And once catheter is in position, when catheter is in position, we have to inject the contrast media or dye as we calculatory way we taken before. Okay, that is according to the patient weight and height, we are taking an already prepared a particular amount of dye. Okay, we have to inject that when catheter is in site. Nurse should monitor the hemodynamic status of the patient at this time, and we have to kept all the cardiac life support drugs every time. Okay, chance of complication is very high during this procedure, so we have to keep the cardiac life support drugs and machines ready. Okay, procedure continues. Then patient should be monitored for any cardiac arrhythmias. Every time we have to check for any cardiac arrhythmias, and the size of the chamber pressures are checked as per the need of the patient. Okay, need of the patient or patient condition, we have to check the chambers and the pressure. To visualize the coronary artery, the catheter is introduced into the ascending aorta. Okay, ascending aorta, and contrast is pushed, and that images will be taken. To visualize the coronary artery, the catheter is introducing into the ascending aorta. If therapeutic is indicated, it is done according to the need of the patient condition. Then patient pedal pulse should be monitored frequently because of chance of pure perfusion in the extremity. Then once procedure is done, the catheter is removed and a pressure dressing should be applied. Pressure dressing, because chance of bleeding is very high because a direct artery procedure is doing in the artery, so very pressure bleeding will be there. So we have to apply a high pressure dressing. Then patient is shifted to recovery room for observation. Okay, these are the procedures. Next we can see what are the post procedural care. Okay, for this procedure 4 to 6 hours bed rest is very compulsory. Okay, 4 to 6 hours bed rest is very compulsory. Then observe the catheter site for bleeding or hematoma. Okay, catheter site should be observed for bleeding or hematoma, and take a 12 lead ECG and correlate the findings with the before. Then check peripheral pulses in the affected extremity. In first 1 hour we have to check in every 15 minutes, and next 1 hour we have to check in every 30 minutes, and next hours we have to check per hour, every hour. Okay. Then monitor hemodynamic status continuously. Then watch signs for complication, and keep the advise the patient to keep the affected leg straight for 4 to 6 hours. Then head end can be elevated to 30 degree. Then started feeding and advise more fluids, because the dye should be eliminated through the urine. Okay, so we have to encourage more fluids. Then repeat labs if needed. Sorry, we can see the complications. What are the complications of coronary catheterization? First one, arrhythmia. Okay, first one is arrhythmia. Then thrombosis, the pericardial tamponade, embolism, stroke, myocardial infarction, bleeding and hematoma, and contrast reactions. These are the complications, and mainly death will occur due to arrhythmias. Okay, in 1.1 per 1000 person we are occurring death due to arrhythmias. Sudden arrhythmias will be there. Okay, so arrhythmias, thrombosis, pericardial tamponade, embolism, stroke, myocardial infarction, bleeding or hematoma, contrast. These are the complications of cardiac catheterization. Okay, till now we are discussed about cardiac catheterization definition, purposes, indications, and the procedures and the complications. Okay, hope you are all understand the procedure. Thank you.